and there's decreased pulses. But remember, you've got arteries, veins, and nerves. So this is hard because generally if you have an arterial problem, what do? You make them stand up, right? And that takes care of it. But if you have a venous problem, you make him lay down and raise his feet, and that takes care of it. But now he's got everything involved. So this poor guy has to do Berger-Allen's exercises. And essentially what that is you lay down, for a few minutes. Okay, elevate your feet for a few minutes, sit for a few minutes, stand for a few minutes. You can do this all day long. But, or as long as he has the symptoms anyway. But that's what he's got to do. All right? Now, remember, the key is, with an arterial problem, what's happening here is that the arteries or the heart is unable to pump the blood to the extremities because of some blockage or other. So you're going to use gravity to help you. So if he has a problem getting the blood to the lower extremities, stand up. If you stand up, gravity helps pull the blood down to the extremities, correct? With an arterial problem, if he lays down and puts his feet up, okay, so just laying down, he's going to have pain in his lower extremities, his feet are going to turn white, and he will not be able to palpate a pulse. That's with an arterial problem. So the 3 P's, pain, pallor, pulselessness, the 3 things that you find with an arterial problem, okay? With a venous problem, that's reversed. With a venous problem, if he stands, there's pain, okay, but if he lays down and elevates his feet, the pain goes away, okay? With a venous problem, if he stands, the legs turn bright red. Remember, there's the problem with the return of the blood, so it pools. Okay? But if he lays down and elevates his feet, then the pain goes away, the redness goes away also. Okay? So again, just remember the difference between arterial and venous. Arterial, you stand up to take care of the problem. Venous, you lay down and put your feet up in the air. Okay? All right, Raynaud's disease occurs primarily with women. Raynaud's disease is what I call a really patriotic disease because it affects the fingers and the hands, and your fingers and hands can turn red, white, and blue. Red, white, or blue, or all 3. It's very patriotic. It's caused by it's a disorder of the small arteries, and it's caused by the cold. So if you have Raynaud's disease, do not move to Alaska. Okay, go down to Florida or Arizona. In point of fact, I had a patient present to triage when I worked in Florida, and it was 95 degrees out. She had woolen gloves on her hands when she came into the ER. And she says, I have no idea what's going on, but my fingers and hands hurt. And I took the gloves off, and I saw the coloring. As soon as she told me, she came in with the gloves and everything. As soon as she told me, I figured to myself, it might very well be Raynaud's. So gave heads up to the doctor, and he agreed. And she did have Raynaud's. It can be congenital. It can occur later on in life, and generally does occur later on in life. It's not something that you're born with and it occurs immediately as soon as you're born. This woman was 38 years old, and it was the first time she'd ever experienced it, and she was terrified. She had no idea what was going on. Her hands were red, white, and blue. Okay, Raynaud's phenomenon is really pretty much the same kind of same symptoms as Raynaud's disease, but Raynaud's phenomenon is not the disease, it's just the phenomenon. Symptoms are the same, okay? Make sure, though, that they do stay away from cold environments. The numbness can be bilateral or symmetrical, and you can certainly have tingling in the hands. So what's the treatment? Well, the treatment for both Raynaud's disease and the phenomenon is if the person is smoking, tell them to stop smoking. You will see procardia and dibenzoline being given. Okay, it works. We don't know why it works, but it works. And hey, if it works, let's not reinvent the wheel. We also want to tell them to avoid extreme cold and stress. And I love it when you tell people to avoid stress. Waking up in the morning is pretty stressful, Not having a cup of coffee is pretty stressful, too. So you tell people avoid stress, and they look at you like you have 16 heads. Well, you still got to tell them. The NCLEX wants you to tell them this, okay? So you will tell them this. Avoid stress. Do not get on the subway, then. Very easy. All right, there are some skin differences between the arterial problem and the venous problem as well. With the arterial problem, you have something called dependent rubor. In other words, when he stands, he's got the feet turn red. Remember we talked about this? Okay. When he lays down, the feet are going to turn white. The nails are going to be thick. The skin's going to be shiny. With the veins, though, there's going to be some brawny, dark brown. Have you guys seen people with like venous ulcers, cellulitis around the legs, right? Isn't the skin kind of dark brown, brawny? Right, that's what it is. The skin's also really thick. And sometimes there's some dermatitis involved as well as with the venous problem. Okay, ulcers can form in both the arterial and the venous realm, okay? With the arterial problem, what you're going to see as far as the ulceration is concerned is that they're going to be primarily at the tips of the toes and at the toe webs, and they're going to have perfect circular demarcation. Okay, they're going to be absolutely perfect. With the venous problem, what you're going to find is your skin ulcers are going to be around your medial or lateral malleoli, which means what? Your ankles, that's what it is. It's going to be right around your ankles, right around your shins, and the demarcation of the ulcer is not going to be perfectly circular. It's going to be pretty jagged. Okay, so that's the difference. Arteries, tips of the toes, and the toe webs, so at the end, rather. Okay, and it's going to be the ulcer is going to be nice and circular, whereas with the veins, it's not going to be at the end of your system. It's going to be right around your ankles, your shins, your tibia, fibula, okay? And the ulceration is going to be pretty jagged, all right? Varicose veins. Any woman who has had a baby can tell you about varicose veins. It happens. By the way, what's a hemorrhoid? It's a varicose vein of the rectum. Yeah, it's essentially what it is. Yes. Okay. I said, what's a hemorrhoid? And somebody went, okay, no. A varicose veins is caused because the valve doesn't empty completely during muscle contraction. Okay, it's due to incompetent emptying of the valve. Remember, in the venous system, there is no pump to pump the blood back. What the heart does is pumps the blood away, and actually the pressure of what the heart does, pumping the blood to the extremities, continues and allows that blood to go back into the venous system and to come back to the heart. In the arteries, there are no valves, but in your veins there are, and they're all one-way valves. And essentially what they do is these valves need to empty completely during contraction, and a lot of times they don't. And so what happens is that there's a backflow and the blood just sits, okay, and that causes your varicosity. People with varicose veins will tell you that their legs just absolutely ache from standing, okay, and their skin can turn a little bit brown from the blood. That most specifically, and this is the one they're going to tell you the most, is that these veins are going to be elongated and they're twisted. Okay? Well, there are treatments now. There are treatments for these things, right? You stop smoking. Anti-embolic stockings, certainly. You're going to watch the feet for pulses and stuff like that. Ambulate a lot. Ambulating, the more exercises that you do, the better your blood return is going to be. Your positioning is going to be flat or at 15 degrees. And, avoid constrictive clothing. And that basically means, those pants that it looks like you got poured into? Those really tight pants? Yeah, that's got to go. Okay, absolutely has to go. And then vein stripping is the last one. And this is actually a procedure. Okay, I have a very close girlfriend who is a nurse. And she learned how to do this, to strip veins. So she tells everyone that she strips for a living. Anyway, she charges a lot of money. She really does. It's like $250 for the very first injection, and then it's $125 for each injection or each procedure afterwards, and you have to complete like a set of 6 or something like that. And it doesn't take much time. But she makes a really good living doing this vein stripping thing. If you have a problem with deep vein thrombosis, if you've got a problem with poor circulation in your lower extremities, you're more susceptible to deep vein thrombosis. If you've got high cholesterol on top of it, then that increases your risk of deep vein thrombosis. Okay? And deep vein thrombosis is secondary to dehydration or hypothermia. surgery complications of the use of oral estrogens. Now, here we go, okay? Patient that just came out of abdominal surgery, is he at risk for DVTs? Absolutely. Patient that just came out from a cholecystectomy, is he at risk? Absolutely. Patient that just came out from a dusting and cleaning, dilation and curettage, a DNC, okay? Yeah. Is that person at risk? Absolutely. You guys are much more awake now. Thank you. You're catching all my very bad jokes. Excellent. Okay. So, all these people are more at risk, right? A woman who's taking hormone replacement therapy. Remember now, there's a big thing about hormone replacement therapy. It's not a good thing because you're more at risk for DVTs. Okay? So, a person who's on birth control pills. Okay? Is that person at risk? Absolutely. So you've got these problems. Dehydration and hypothermia are some other situations. Now, here are some case studies. This is a true story. This is a 48-year-old black woman who was homeless, and she was found, this was in Richmond, Virginia. She was found by the EMTs. It was around Christmas. And what we used to do in our hospital in Virginia around Christmas is we had this deal. We worked night shift. Every Christmas Eve and Christmas night would work night shift. Okay, and this is before I had kids. And this is the one sole and only reason was because I had this deal with the paramedics. It was not myself and a small group of nurses, and we all always worked night shift on Christmas Eve and Christmas Day. And the deal was they would troll the areas, okay, and what they would do is they would find every homeless person living out in the street. They would throw them in the back of the EMS truck and bring them into the ER. Okay, we would feed them, we would let them sleep in a warm place overnight, and then we'd say bye, see ya in the morning. It was our Christmas gift to them. Nice warm place to sleep, and we'd feed them also, okay? So that was just our Christmas gift. Anyway, this was Christmas. This young lady was brought in, 48-year-old black female, homeless, poor skin turgor, and she was found at this Christmas, it had dropped below freezing, and it was like 28 degrees. If you touched her legs, she screamed. Okay, now this woman was at risk she had every risk factor except the oral estrogens. She wasn't taking birth control pills, didn't have money. But she was certainly dehydrated. She was certainly hypothermic. Okay, and, well, what was her problem? Well, she had frostbite, definitely. Yeah, because she was out in the cold, and, she certainly wasn't dressed that well. She had newspaper wrapped in her shoes to keep her feet warm. Big holes in the shoes, especially in the soles. But certainly she had the hypothermia and she had the dehydration. Well, it turns out that she did have DVTs and she also had a severe case of frostbite. So this poor woman lost all her toes. It's very unfortunate, but she lost all her toes. But that was the bad side. But the good side is that because we got her into our system, we managed to find her the right social workers and the right contacts. So she got into the system and got help. And she actually went to a shelter. And, this is a woman who just fell down on her luck. She really didn't do this on purpose. She just fell down on her luck. And the positive side is that a year later, she showed up in the ER. We didn't recognize her. Yeah. She got a job. She didn't have her toes, but she got her job. Yes, so we got her into the system. You see what I mean? So sometimes the system does work. Anyway, my next scenario here is a 36-year-old white female who just had an appendectomy, and she's been on birth control pills for 5 years. Now, this woman is doubly at risk now for deep vein thrombosis because she just had surgery and she's been on birth control pills for 5 years. So she's doubly at risk, would you say? Just want you to be aware of that. Now, how do you know if a person has deep vein thrombosis? Well, we always do that Homan sign thing, don't we? We say, okay, and now you've got to know and you've got to be able to describe to yourself exactly how a Homan sign assessment test is conducted. Dorsiflex the foot, and where's the pain? In the calf, right. So if a patient does have deep vein thrombosis, what do you tell them? Well, you tell them bed rest, right? You are not moving. Bed rest. You can elevate the extremity, but you want to avoid the knee gap, so avoid pillows underneath the knees. Do not massage the site, please, whatever you do not massage the site. You can put warm, moist heat to the area, but not direct heat. Warm, moist is okay. The skin will be red and hot to the touch. Okay, you need to know that you have to measure that circumference right around the